And then I'm gonna go back here, and then we'll do them in just a minute.
I got one question.
Sure.
Do you want us to introduce ourselves?
Just like for
Okay.
the patient. So you're the PRN nurse for a
You can
small
introduce
community
all.
hospital. The supervising RN asks you to see a new patient in ED room 5 and begin his assessment. She states she'll be there shortly to help you. Daniel's information is as follows. He's a 65-year-old male presenting with respiratory distress. He has 40-year history of smoking 2 packs a day. He was employed by the furniture manufacturing industry for 35 years prior to his retirement. Daniel reports a very productive cough early in the morning. Medical history is positive for an MI times 1 with stent placement. Patient is unable to recall which vessel was stented, COPD, and depression. He states that he feels bad and has been increasingly short of breath for 2 days. He states that since his heart attack, he has had some problems with his ankle swelling, but they are bigger than normal. Daniel states his current medications are Lasix, Dig, Advair, Prozac, and due to increase in living expenses, he has not been able to have them filled. He's an established patient of a community cardiologist, but has been missing his regularly scheduled appointments due to financial reasons. He denies pain.
Hi Daniel, I'm Marie. I'm going to be one of your nurses today.
I'm Rhea, and I'm also the nurse today.
I don't feel well.
Okay, what's wrong? Okay, on a scale of 1 to 10, what's your pain level?
He has no
He
pain.
just
I've
said
had the pain for a couple of hours now.
Okay, on a scale of 1 to 10, what is it?
Oh, I can't breathe and my chest hurts.
I'm
Help.
Raise the bed.
Ask if he has any oxygen on. Does he have any oxygen on?
No.
Okay. His fingernails are blue, so let's go ahead and raise the head of the bed. And we need some oxygen. And I need a set of vitals, please.
Okay, he has 2 liters of oxygen on.
Do what?
He has 2 liters of oxygen on.
He's got it on now.
Yeah. He's on his lead.
On the right side.
Okay.
I'm sure it'll be good. So do we need to administer his medications if he hasn't had them?
Lasix.
He does need Lasix. We need to know if he's had any more output or anything like that.
Okay. What's his
His lasers.
input and output? Intake and output.
1,200 in, 200 out.
Okay, he hasn't had enough out.
Need to give him his Lasix. That's when you give him Lasix or any of his regular medications.
Okay, can we go ahead and give him Lasix and any of his regular medications?
You can give the Lasix and the Dig.
Okay.
Your pharmacy. You give it, you have to tell her that you're giving it, that it's already been given.
Pharmacy.
Okay, we're giving Lasix and Dig. Let's check his bowel sounds.
Did you know how much Lasix there was?
Do what?
Did you have to know how much Lasix or how much
How much Lasix was that?
How much did you want?
How much the doctor's regular dose?
What's his regular dose?
He doesn't know.
He doesn't know. I'll check with the doctor.
Do you have to check with your Lasix?
20.
Yeah, check with the doctor.
Can we check with the doctor?
Yes. You can give 40.
Okay. We're going to give 40,
Lasix and
A
check
Lasix.
with the doctor how much it is to get home.
and we also need to check with the doctor on the Dig.
Pharmacy don't know.
The doctor wants to know what his apical heart rate is.
You listening to me too?
Yeah.
I don't hear anything. Just the breathing. Oh.
69.
It's not regular.
It's not regular, you can't give it, can you? Cause digits between 60, not between 60 and 100. Or irregular.
That can't be his heart rate that I hear. Listen right there, because that's it's a bouncing. That's not it. Not hearing anything more. So I guess you're gonna use the 68. What's on there? Because I can't hear anything if you on it.
Here, Louise.
Yeah, you can't hear
And
anything.
his heart rate's going up. He needs to have some ditch now.
His heart rate's going up. So now it's too fast for digit.
Okay, okay, his heart rate is irregular, and it's too high for Didge right now.
Pulse oximeter needs more of
And we need some more oxygen.
So try exhaustion up to 4 liters, but you don't want to give him too much. He's COPD. And I
Okay,
don't
your
even know if he's
respiratory.
I don't know if he's a CO2 retainer.
Is he a CO2 retainer?
No.
So you can give exhaustion up to 4. A non,
You want to do 4?
at least 4.
Okay, we're going to do 4 liters of oxygen. You wanna raise-
Great.
What did she say? You want to raise the head of the bed some more?
Yeah,
And we're going to raise the head of the bed some more.
that's not too much. Because his legs are swollen too.
Let's check. Let's check the rest of them.
Ooh. Okay. See, with all the fluid, has he had any more urine output?
We need to know his output.
Maybe he's having right heart just
300.
300. And can we get another set of vitals? And his temperature.
He's going into his temperature last time.
100.1.
Alright, he needs to have some Tylenol.
Has he had any pain medicine?
No.
Okay. Can we give him some Tylenol?
Yes.
Okay.
Time they need to take some deep breaths into his
Let's
nose and out
elevate
of
his
mouth.
legs with the pillow. I'm not
Take
gonna raise
some
him.
deep breaths into his nose and out of his mouth.
Okay.
To help increase his oxygen.
Take some deep breaths in and out
And cough.
and cough. And we're going to elevate your legs. You got a pillow?
No, we're elevating his leg.
We're elevating his legs with the pillow due to the swelling.
He need to put his head back up.
Do what?
He need to put his head back up.
Okay, we're going to raise him up some more.
Did you ask about if we're going to get any kind of pain medicine?
Yeah, we're getting Tylenol. Has he received the Tylenol?
Yes.
How much?
650.
$6.50.
How much liters should go to?
Where's his
He's at 88.
If I can put him on a non-rebreather, his
a what?
a non-rebreather, or no, just a mask,
Can we put on a breathing mask?
no 2 masks, a beanie mask,
What kind?
a beanie mask,
A Benny mask?
at least.
Yes.
Okay. Okay, his systolic's dropped.
I mean, how much more fluid's going in?
What's his intake and output now?
Can we get an EKG or anything?
1,300 in, 400 out.
Okay, no.
Do what?
I don't need to put more fluid in. Can we like get an EKG or anything like that?
Can we get an
And
EKG
chest X-ray.
Yes.
Chest X-ray.
and a chest X-ray?
Yes.
Okay, his systolic is 85. His blood pressure is really, really low. Are you in any pain right now?
No.
Now Ask the doctor
Okay,
for something
cool.
to lower his heart rate.
Do what?
Ask the doctor for something to lower his heart rate.
Can we ask the doctor for something to lower his heart rate?
Can you?
The doctor says you can give him 0.25 a ditch.
Okay.
Okay,
We're gonna get it.
we're giving that.
Ask if we have the results of the EKG.
Do we have the results of the EKG?
No.
Okay.
Or chest X-ray.
Or chest x-ray?
Chest x-ray shows bilateral congestive heart failure.
Okay. So he's wheezing and he's swallowing. New set of vitals.
We need a new set of vitals.
And a new temp.
And a temperature.
991.
Okay, it's going down.
His heart rate came down and his O2 went back up. We gotta check this back.
Alright guys, let's debrief a little
I
bit. Let's
wasn't
walk
worried
in
about
here.
this. I wasn't worried about that.
Walk in here.
Functioning.
Very good.
Worry about it, James.
I feel like I'm breaking
Everybody's balance.
Do what? Oh, just nervous. Just nervous. I know nobody can be sick. Alright. Well, what did we do well?
Got his heart rate back down and got his O2 up.
Exactly. What else? We did a lot of stuff well.
And his fluid check kept checking his urine output and everything. His fluid fluid overload.
In and out.
Got his temperature down.
Sorry, what else did we do good?
All I can think of was we didn't do that.
Okay, well, let's talk about that.
Okay.
Let's talk about that.
We did a focus assessment.
We did a focused assessment. What did we focus on?
The heart. What was the heart right then? And it was breathing.
Okay, so let's look at that focused assessment. We did a heart and a lung focused assessment, right? So what all does that involve?
His breathing, his mucus membrane, urine output, cardiac
Okay, we forgot to ask about enzymes. What else did we forget to ask about? Capillary refill, but we noticed cyanotic fingers.
She did say.
She did say that. Did
Supposed
we
to have
notice
been
edema? And his legs, did we notice JDD?
No.
Did we notice that? That's okay. That's all right. Just want to point that out, Tammy. We all forget stuff here and there, and it's okay. This is where we want to point stuff out and learn stuff.
And here's my question, if they're having trouble breathing, you need to raise them up, you got their legs need to be raised up too.
Which is the safest thing for the patient? The breathing part. So if you get a board's question that said they're swollen and short of breath, which one do you do? Airway, breathing, circulation, exactly. Always the safest thing first. Okay, so what kind of lab value should we put on that? BNP, troponin, I would have gotten a digital open, yes, electrolytes. There's some stuff I heard that I couldn't pick out. B90 creatinine. Exactly, all that, all right. We've got the EKG initiated. You got the O2 on, you got your eyes nose, you think high powers, yes, you got the temp. You now basal legs, you got the leg six. You asked for Tylenol. Tell me what your thought processes were for Tylenol versus morphine. Right, with morphine to help with his breathing. And cardiac output, right? Morphine helps with cardiac output as well. Exactly. science research takes a while to catch up with boards. Okay, so you're gonna test 60 for boards. Some places do say 50. A lot of your long-term care facilities will say 50 because these little patients don't have heart rate of 60 ever. So, boards you're gonna test 60.
When you said, was it a full pulse? And there, and you, I can't, you can't hear on that. Am I, was I supposed to?
No.
Oh, because I was like, I put something mechanical and it wasn't right.
That's fine. And it's part, he did have an extra pulse, but, I mean, if you didn't hear it, that's okay too. It's hard to hear sometimes on the end, he clicks a little bit, but you, as long as I knew that you knew where an ankle pulse was and how to count it and what to look for, I was
The
good with
reason
that.
I said high was right here, because it's the recourse compliance. It says it was irregular, usually less than 60 or greater than 100.
Is that's the range that needs to be between, to at least, yeah, right.
Yeah.
Yeah, but your heart rate's never too, yeah, it was, but it's never too high. Yeah, well,
Because it said
it's
total
like too
within
much.
Does the dose change the higher the heart rate?
Yes,
Okay.
yes. So what was this little fella's risk factors for CHF? Smoking, working in a factory, working in a factory, COPD, all those things. Who else would have helped us on our healthcare team? We had nurses, we had respiratory, we had pharmacy, who else would have helped us? Lab person would have helped us, who else? A doctor would have helped us.
Social worker.
Social worker would have helped us. What about nutrition? Yeah. Dietary, we're gonna have to see somebody from cardiac rehab probably. Who else might this patient need?
They might need kidney.
That might be the renal physician, they might need, somebody from the renal service.
So, this poor guy was in the emergency room with his LPNs, we couldn't do that, original mandatory assessment. So, should we have questioned it right from the start when she told us? Cause that's the first thing that popped into my mind.
That's the first that, yes, you should have questioned it, and that's a good thing you caught your scope of practice, that's the next thing on my objective list here to hit. So in your scope of practice, you're not supposed to do initial assessments, right? Right. So your lead RN sent you in there to do that assessment, he was in distress when you walked in. What would have been the safest thing to do for him? Put some oxygen on him and go get her. Exactly. She needed to be in there. She needed to be in there. I mean, you gotta do a great job taking care of the situation, but I always want you to remember your scope of practice in the back of your mind. Okay? Because sometimes the LPNs get used their scope of practice, they really do.
So, in this scenario, did we handle that more as an LPN lab or an RN? Because
You did a little
based on
bit.
what we did with that test while ago, we're kind of stuck between
You did a little bit.
doing too much or not enough.
You did a little bit, really. I mean, your interventions were LPN friendly. Probably the assessment and the setting was already, very few LPNs practice in EDs. But that's